Last year, the president directed for the increase in the monthly pay for intern doctors from 750,000 shillings to 2.5 million Ugandan shillings. The presidential directive, contained in an August 9, 2021 letter, was addressed to the Prime Minister, Ministries of Health, Finance and Public Service, but to this date, the promise has not been fulfilled.
The intern midwives, oi! The intern doctors, oi!
In a press conference held this morning by the Federation of Uganda Medical Interns and their counterparts from Uganda Medical Association in Kampala, they have given government a 3-day ultimatum to fulfill the presidential directive.
We are giving government 3 working days to make sure that all our concerns are addressed, and within those 3 working days, we are only going to maintain emergency services in all hospitals. Why? Because we don't want Ugandans to die.
According to their president, Dr. Musa Nasul Lumumba, medical interns have demanded for an increment in their remuneration, as well as improved general working conditions, only to be ignored.
I'm not going to be a president who is going to let his people earn less than what the president promised them. Dear medical interns in this country, I promise you, I'm not only going to make sure that you have light at the end of the tunnel, but I'm going to fight to ensure that we have light throughout the tunnel.
You take photos so you can see.
The president of Uganda Medical Association, Dr. Samuel Odong Oledo, has urged government to respond quickly to the demands of the intern doctors, revealing that they need all the help they can to get during this time when the country is facing an Ebola outbreak.
Government comes up with grateful and fast resolution measures to make sure that these individuals, the medical interns, are back in the hospital as fast as possible. Because we do not want them away from us. Right now is the time you don't want any health work away from the hospital.
Government has also been urged to consider employment of the medical interns.
A presidential directive was clear. Let's have health workers deployed to health center 3s. This has never seen the light of day. These interns have 5 months to finish. But their deployment is out of the roof. You don't know if they are going to be given jobs. When we have only 40% staff.
We thought our future was secured by His Excellency the President of Uganda. Why are we not sure of the jobs we are going to get after internship?
If the demands of the medical interns have not been fulfilled, they will go for on strike.
For 7 months we have been quiet. We did not want to be a lot that makes that strikes and does this and that. However, we are tired and we are going to have to strike because clearly that is the language they understand.
The first and what is affecting us most is the salary disparities among us as interns. We shall not get tired of quoting the letter from the president that was dated 9th of August 2021 that directed that medical interns countrywide should receive half of the recommended pay of public officers that are in the respective cadre.
This is not the first time medical interns have threatened to go strike. Last year in November, they went on strike under the umbrella Federation for Uganda Medical Interns, demanding for an enhancement of allowance and payment of arrears. The strike was called off in late December of 2021 after government promised to meet their demands. Tony Patila Humza, CTV, Pimo Edition.
Interns oi! Oi! Interns oi! Oi! Ra! Ra! Ah! Interns must survive!
That is the Twitter jobs trigger this morning on the discussion we are having. Medical interns have been having lots of incessant strikes. My name is Eston Munanura in the studio this morning and to dissect exactly what is happening. But currently in the studio I'm having Miss Navida Shamim, Vice President of Uganda Medical Interns United. Well, Miss Shamim, good morning.
Good morning.
Yes, how are you?
I'm all right.
Yes, tell us, by the way, there are so many factions within the medical association. I don't know which one do you belong to?
First of all, good morning, viewers. I'm called Navida Shamim, Vice President, Uganda Medical Interns United. So you know where I belong.
Yes.
Uganda Medical Interns United.
What about Federation of Uganda Medical Interns? Is that something different?
As you see, it's not so much different. As you see, in our society, we have many organizations. So we can have small organization, and then we have maybe a big organization where those small organizations fall.
So what exactly does Uganda Medical Interns United now do?
Maybe before we go deep into Uganda Medical Interns United, today we'd like to discuss more about why we've gone for the strike. Maybe we shall discuss that later, but the objectives are not so much far away from those of Federation for Uganda Medical Interns.
Okay. So now, what are the issues? Why are you bickering? Like, what is driving all this? Because it has been long. Haven't you made enough noise and you're not being listened to? Isn't this frustrating?
Maybe the question would be, why isn't the government responding to us after making all the noise? Because ideally we are also very tired of making noise. After having peaceful negotiations, drafting letters to ministry, to the government, having dialogues with them, meeting them in their offices, some have failed to meet us. They are not responding to us. What are we left to do? For a full year, since August last year, we are discussing the same things. They are promising to fulfill their promise of correcting the disparities in the pay of interns. I also happened to be the Prime Minister. I was in the meeting with the Ministry of Health. You remember when the nurses countrywide called for the strike. Also, intern nurses and midwives were involved. So we went to the ministry, we met public service, the Minister of Public Service. They promised us that our money was in the budget. We were patient and we are good people. We waited till July, the financial year, when they told us our money will be coming. And I was calming down my subordinates that you be sure the money is coming. But it's very sad that the government is not implementing what it promised us. What are we supposed to do?
Well, just give us a sneak peek of exactly what are you people going through. Because I listened to one of the, I think, FM stations talk shows, and obviously it was away from the strike, but he was talking about health workers that were responding to the Ebola pandemic. And he made a revelation that everyone, I think, daily allowance is only 80,000. Now, commensurate to the risk they are facing and the 80,000. Now, if you people are not being paid, I can imagine what you're going through. So tell us exactly what the interns who are doing a credible and commendable, complementary job to the mainstream health sector. What are you exactly going through?
First of all, a medical intern is not a student. A medical intern is a graduate. We are already graduated, and then the government deploys us in the referral hospitals and national hospitals to work for it. So we already have the skill and we have the knowledge. But at the end of the day of 1 year of internship, you're assessed. That's why we are forced to be there at the deployment centers. So a medical intern, most of them at their sites, you work 24/7. Some even work for 48 hours, 96 hours, because they make the biggest part of the healthcare system, right? Especially in Uganda, in referrals and then national referrals. That's why when they leave work, the whole sector is greatly paralyzed. So a medical intern who works 48 hours, you can't find time to go out and get maybe another gig to give you money. At the end of the day, you're not given accommodation, you're not given food. Imagine the people who are living around town. You have to rent a house of 400. Now the government sends the money after 3 months. At the end of the day, the money is very little. On top of that, the money is very little. You have to pay 400,000, maybe rent. You have to feed yourself. You have to transport yourself. And you also find these medical interns are working day and night. Someone has to go for night duty. You know where the economy is, how much we are spending. So we are suffering all of that, and at the same time, they are not implementing the presidential directive. We are still receiving peanuts. Since last year, we are in negotiations. We've tried to be good people. We are not striking. We have met them. We have told them what we need, and they told us the money is in the budget. How comes from July up to now, we are not receiving our money? So initially, they implemented the directive for the doctors, intern doctors, but the nurses, midwives, and pharmacists were left in space.
All right, right about now, I'd like to bring in Chigozie Edwin. We are joined by him also on set, and he's the intern nurses representative, Uganda Medical Interns United. Well, Chigozie Edwin, first and foremost, welcome to the show.
Thank you very much. It's a pleasure being here.
Yes, let me hear your side, your take. What is exactly happening? Why are there incessant strikes from your view?
Of course, these strikes, I can say, one, they are uncalled for, and I don't mean to say that I don't support the side of the interns, but I'm talking as someone who has the heart of the nation. From the grassroots, these interns are deployed at locations where they don't even bear a relative, they don't even bear a friend. You just have to go where the Minister of Health has deployed you. Meaning that you are graduating today, tomorrow you are taken to an unknown location. Meaning that you cannot even, some of us cannot even call our relatives for assistance. It's rare that people support someone who is already working and earning. So we live sustainably by the allowances we get. However, in a bid to ensure that our basic needs are met, the president gave a directive that medical interns should get half of what their seniors are paid. However, there is discriminative allocation of the resources. That is reason number one as to why these strikes shall never end unless we have these fully implemented. In this, I mean that the doctors were considered, the nurses, pharmacists, and midwives were left out because the doctors were already given their 2.5 million, the pharmacists didn't realize it, as well as the nurses and midwives didn't get the then 2.4 million. And even after the implementation of the financial year budget for the health workers, the medical interns still didn't get the 2.2 million who are nurses and midwives. As well, the pharmacists didn't get the 5 million, the 2.5 million, which they are supposed to get. So that factor has really separated us as medical interns. However, I can let you know that it is now the strongest factor that is uniting us. So we have unity in the medical interns fraternity based on our problems and the background. However, we have disunity between the medical interns and the Minister of Health, which is our chief employer. So
yeah, very much. I really get your point. And Ms. Shamim, okay, basically right now, whereby we have a recession looming, I really understand the pressures that public servants are going through. You're not the only people complaining. Even some in these MDAs, ministries, departments, and agencies are also complaining of the same. It seems to be uniform. But do you think there is a political will to, because you might have met almost all the stakeholders, the policy makers in the Ministry of Health, do you think there is a political will to address this issue? Even if the president pronounced himself, but this could be pronouncements, and maybe they may not be telling you the truth that they just don't have the money at the moment. So how would you go about that?
Yeah, yeah, we are very ready to meet Minister of Health, but I don't get it that even at this point, after calling for a strike, they have not responded to us. They have not called us for any negotiations or to talk about our strike. So that means that they are not concerned and they don't care. But for us, we are ready to meet Ministry of Health or the President to discuss our issues on how we can go about this. We don't want to strike all the time because we feel for our people. Even if we strike, it is a person of low economic status who suffers. The ministers we want to get the money from who need to implement the directive, they can take their families to private institutions. But Omuntu Wawansi is the one who suffers. So as interns, we really don't mean to strike to cause more suffering to the economically low person, but we are ready to go into any negotiations so that we can have our money. And I don't believe the money is not there because we have been in negotiations. I told you for the last 8 months, we've been writing letters, we've been meeting these people, and they promised us, even our petition went to Parliament, and they told us they passed the money. Now, where is the money? Who is to blame? Who has the money? The budget was passed. We've been patient. This thing was to be implemented early January. They told us it was a mistake that nurses and midwives were given 1.5. It was a mistake. And it was a mistake that pharmacists were given 2 million. They're supposed to get 2.5, but it will be corrected. We tried to engage them, and then they said, no, let's wait for next financial year. I told you we became patient. But we continued with the negotiations. Even at, before July, we were writing to them to remind them, because we know they can be busy or they can forget, to ensure they don't forget us. Even our colleagues, when they could say, I don't think this government will give us the money, we're like, the money will come. We have done our best. We've talked to these people. And the budget is passed. They have told us they have us in the budget. So we are expecting the money to come. But look at this now. We are questioning their integrity and honesty. What do we do?
Well, Edwin, let's look at maybe, for avoiding to sound hypothetical, how sustainable is this strike if the demands are not met to at least to a scale of 1 to 10? If they are not met at 5, the scale of 1 to 10, how sustainable are you going to keep this strike going on? Won't you end up shooting first and aiming later?
That is a very good question to me. However, I would prefer it being phrased like this. How sustainable is internship if our demands are not met? We are facing an endemic, that is Ebola. The Ministry of Health itself doesn't provide enough personal protective equipment. It knows very well. Most of us have been buying personal protective equipment. Since we are the frontliners, we care about our health from the little we get as allowances. Secondly, we parent. Which landlord waits for 3 months to elapse to get a penny out of a tenant, bearing in mind the fact that the Ministry of Health only accommodates less than 10% of the medical interns? 2, who can provide me food for more than 3 months or even 3 months without being paid? 3, where can I get transportation to the hospitals to go to work every day for 3 months without paying a penny? So the standard of living is the question I would wish we pause first before even pause about the strike. We as leaders, we have a mandate to go back to the grassroots, talk to our people, but if really the Ministry of Health has a mandate it holds in serving the nation, it should really give us an ear as soon as yesterday. Because the strike wasn't abrupt. We gave them from 20th October to respond, but they did not respond. Meaning that is a Ministry of Health that doesn't care about the interns.
Is it because they don't care, or they maybe just don't get your concerns? Because in one or the other, Edwin, you'll be the one to react to this before I come back to Shamim, that maybe they just don't get it, that they may be out of touch with maybe what you're going through, because if up to this time you cannot tell me you've been bickering over this issue for the last 8 months and you're not being responded to. Now, I wouldn't want to ask you this question, that is the strike the last option? And if it is your last option, what other option is there to see that your concerns are met?
The responses have been phasic. You know, you don't just come up with an industrial action before engagements. Way back, let me actually tell you what really happens in internship. Our chief employer is the permanent secretary. It's with whom we sign the contract. But the overseer, the father of medical internship in Uganda, is the Director General of Health Services. Each site has an internship coordinator. So that one oversees what's on the ground. We raise these concerns through them, and they sit on the medical internship committee. They even bring us the minutes that this was discussed, this was discussed. So engagements began way back in April. And then even last year, they had the same engagements. This April, we featured into internship, engagements resumed. And then until when the Director General, if the father in the house tells you that you know my sons and daughters, this issue is now beyond me. I've done my best and it has reached a certain level. And then you ask, what next? The father tells you, this is where we should dig to ensure that the gold is mined. You dig the gold today, tomorrow, and no response. We've not received the response to the permanent secretary. Actually, personally, I hold the permanent secretary accountable for this, because at least everybody has tried to respond in the Ministry of Health, unless they have not been reached. But the permanent secretary has been engaged several times. She has not committed herself to this. So, Minister of Finance says, we gave you the money. It's with the Minister of Health. But why don't they commit themselves? If they can't commit themselves, what do you expect us to do?
Shamim, you people, I mean, stormed the gates of the August House and, tried to put your petition before the Speaker of Parliament. The Primary Healthcare Minister, that is Honorable Margaret Muhanga, says these people have been paid and you've called off the strike. Later on, we see, okay, that was a blatant white lie on the floor of Parliament. What is your next course of action? If they say they have paid you, and they were they claim to have the evidence that they've paid, how comes you're not receiving the payment? I don't know whether it is the right question to you. Do you think it is more of a deliberate ploy to delay or to demobilize the strike, that one center of power says one thing and this other says the other?
The major goal of this strike is to correct the disparities of the interns' allowance. An intern nurse and midwife, the intern nurses and midwives are supposed to get 2.2 million, which is half of their seniors, and the intern pharmacist is supposed to get 2.5 million, which is half of their seniors. So the major goal of this strike is to correct those disparities in pay. We had another challenge of delay. Yeah, the truth is that the money has come, but the money has not come as we expected it. As I've told you, the major goal, we want these disparities corrected before we can go back to work.
So the issue is not about not being paid. It is not, it's about more of those disparities. The
issue is more about disparities. We want them corrected. We want to receive the money we are supposed to receive.
So you have been paid. In short, you have been paid, but it is just because what you are promised is not what you are paid.
Yes.
Okay. Then Edwin, I think that is clear. Edwin, is it only salary-related issues that, or there are also other biting issues that you people are facing in your field of work?
Maybe to correct what my sister said, we've been paid. That is what the Minister of Health claims, that money has reached the hospital accounts. But to me, an intern, if I talk to the accountant at the hospital and they say, we've not yet received the money and I've not seen money on my account, then I've not been paid. Plus, maybe she's paid, I'm not paid. Actually, we've received the reports from only 5 hospitals, 5 sites out of the 50 sites, meaning that 45 sites have not yet received the money on their personal accounts. So that I think they just paid the 5 to get enough justification that they paid. But the truth is they haven't paid. And I want to distance away from the words by the Honorable Minister, Margaret Mohanga. I respect her, but the words she uses are not good words to us. We've called off the strike, we've paid, and she distances away from the burning issue of salary disparities. Actually, what I can tell you, anybody fears that issue. We want to dig and ensure that the fear is gone. I want to remove fear from the permanent secretary. I want to remove fear from the Honorable Margaret Mohanga. I want to remove fear from the Dr. Mwebesa. I want to remove fear from the Honorable Prime Minister. As far as the salary disparities are concerned, anybody fears them. They fear talking about them. We want to know, why is it that they fear talking about that burning issue?
Could it be because they don't have the money as yet?
No, you can't tell me that you don't have money when you are just a minister at the Ministry of Health. If someone from the Ministry of Finance, starting with the Honorable Matia Kasaija to Ramadan Gobi, they say that we've given out all the money. And then for you are here not telling me that you don't have the money, neither telling me that I won't give you the money, neither promising to give me the money. So what's in between there?
Well, if all these disparities, in the near future are addressed, is there money that is enough? Because with this rising inflation now, I mean, we are told that now our debt to GDP is 10.7. It has a bearing on the inflation, which also has a bearing on everyone's income. Even if they are addressed, won't we have another strike having to demand more of, we need to increase, because the cost of living every other day is rising. As a medical profession, don't you put that in consideration? I think I would need maybe both of you to react to this same question. Maybe I'll begin with Shamim.
This strike, as we are demanding as per presidential directive, we understand there is no money which is enough, but it's also very good to get some increase, right? According to the economy. I think the system should be in the way that they respond to the increase of the pay of the government workers in accordance to how the economy is moving. But for now, the presidential directive is saying we must receive our money, half of our seniors. Why not receive it? Yeah, so this strike is in accordance to the presidential directive not being implemented. It's not that we shall go on striking and striking and striking, but can you fulfill what you promised us? Can you fulfill what is on paper as per presidential directive? That's what we need.
Edwin, money can never be enough. Even if it just works up one day and every intern is being paid, if the seniors are being paid 12 million and every intern is getting 6 million, what would be your response to this if all your disparities are addressed? Won't we expect any other strike over increased pay over anything to do with salary, because if all these are because the whole essence of the whole strike is more of the disparities in the income levels and the salaries. If all these are, will you be satisfied as the medical fraternity?
I can react in 2 points. One, as far as I live, I'm not going to be a leader in medical internship. Actually, by April next year, I expect to hand over my leadership. So meaning that I can't project what the future brings. But as far as I know, if this one is not worked upon, because this is a directive that has not been implemented, if it is not worked upon, expect the same. Two, I don't think that there will be more presidential directives. I think the president will consider this as enough, having been put into consideration, and we leave the seniors to flow their way as they have been flowing, and for us, we are satisfied with whatever we have. Here may be something little to add on. We want the Minister of Health to develop a culture of embracing dialogue. Let it respect the leadership of the interns. We shouldn't always go to burden the poor Ugandan to ensure that our demands are met. Actually, the poor Ugandans we are burdening are painfully supporting us because we are their sons, we are their daughters, we are their relatives. They can't leave us to die at the front line when we even have a chance to serve them more years to come. So the Minister of Health should embrace dialogue other than waiting for an industrial action.
Yes, now Shamim, isn't this now, I would call it bad PR for the medical fraternity, because in a way that children there at the first instance of asking a child that, what do you want to become, the first, most of them, it's either a doctor, a lawyer, engineer. Now when they hear all these issues of you not being paid, aren't the people that want to join your profession going to shun and shuck from the fact that becoming a medical officer is not as lucrative as maybe other professions are?
I always tell my mentees that being a health worker or a medical personnel is passion to serve your people. But at the same time, we can't serve at empty stomach. We can't serve when we are dead. So that money we are fighting for is basically for our basics: food, rent. Actually, we can't do more with that money than that. So to all those yearning to be medical officers, there is no money this side. You just have to be passionate to serve our people. Right now we have gone for the industrial action because we are overpressed on the wall. The pressure is too much. We are working on hungry stomachs. People could come to my inbox wanting me to lend them 20K to have lunch for the day, 10K to have lunch for the day, because the money is not enough. The expenses are too high. So we are really very passionate to serve, but we can't serve when we are dead. Our families still need us. The future still needs us to serve them. So we only want the government to implement this so that we can have the basics and serve our people.
Yes, Edwin, now, as a journalist, coming out of school of journalism, I also did a Hippocratic oath to the profession. And I think you too must have. Which, mine is more of, telling truth and nothing but the truth and, being balanced and all that. And yours is to save lives. At this particular time, isn't the strike a detriment to that oath you swore to save lives? Because at the moment in the strike, we do not know how many lives have gone in just this space. And don't you think now that is you seem to be pushing a square peg in a round hole?
I'll say no, because there is no statement in that oath that says that I will serve on an empty stomach. I will prioritize your health and safety over mine. You get? No. Actually, as long as I live, I'll be ready to implement the oath. This oath doesn't talk about medical internship being a mandatory training. So this is something which has its own policies. I have to draw back from history to reality. So the reality is internship. Without internship, I cannot even implement the oath, because medical internship is a mandatory training as long as you have a dream to serve the nation. So if I don't pursue medical internship, I'll never serve Ugandans so as to implement the oath. So I'm still fighting to implement the oath, but not diverting away from the oath.
Shamim, could this be the reason, one of the reasons why most medical practitioners are having some bit of conflict of interest within, if you have to choose between serving in the public service and going private, most would want to choose the latter. Could this be the reason as to why in the medical profession, most of them, actually even others, are trying to fly abroad to find, could this be a detriment to your profession?
Yeah, this is very detrimental, not only to the profession, but to the country at large. Because as a nurse, I am a bachelor nurse, you can't tell me that you're not going to employ me in your government facility, yet in Canada they need many nurses, and I'm going to remain there, and they are giving them enough dollars. They may not be enough, but at least enough to sustain their living. So this has really led to brain drain. Many people, you may find in Uganda, if you get a special case or you have a family member who has suffered from a very special kind of disease, you find that even specialists on board in those government hospitals are not there. They have went abroad to work from there, because the system in Uganda can't allow them, no matter how much they read, no matter how much they are giving back to their country, the system can't allow them to work within the country. So
yes, Edwin, do you in a way think that all professions, need some ingredient of patriotism, that even when there is, yes, we all need money, even me seated here. Like, I mean, I will not get, I don't live in a different space. But within the service space as medical practitioners, that sense of patriotism, that, as she talked about the brain drain, that at some point you just need to serve your country, be patient maybe with a little, and hope that maybe the match will come there. Is this one of the considerations you have in the medical profession?
Of course, the medical professionals don't live in a different world of economics. If the Minister of Finance can come out to say, now the economy is moving, and you know what this means.
Yes, exactly.
So until when the economy moves downwards,
yeah,
then that is when we can claim at least we can now set and do what? Serve. But we should go by the standard. So this is an issue where you cannot just put other factors constant, bearing in mind the fact that we even look at our colleagues at work, even the specialists who have served this country for some 30 years, 20 plus. Let me tell you, there is no specialist in the hospitals who serves just at that hospital where the government employed them alone, and then they sustain their life. There is no specialist who doesn't have 3+ jobs, and still you find them still struggling with the economy. What about me, who is needed to work between 18 and 24 and 36 hours? and I don't receive a penny.
Oh, I know. I get, because there's a plethora of clinics around, and you find that even the medicine in some of the pharmacies, sometimes by the time you're going to take that pill, it has UG, and you're like, okay, now this is really getting serious. But we are coming to the tail end of the show, and I would like each of you, I think, to give a minute on your parting shots this morning about the strike and the way forward, and your appeal to the powers that be to address your issue. I think I'll begin with Mr. Chigozi.
I'll give it briefly in 3 categories. I'll appeal to the public, I'll appeal to the interns, I'll appeal to the ministry. I'll begin first of all by thanking the public for sympathizing with the interns, but request it to be more empathetic than sympathetic, because the situation at hand is beyond our control. We know they badly need us to serve them. Some of them even call us right now, where are you? I need the assistance. When we are out of reach, I want to appeal to the public to support us in this cause, because we are fighting a government institution. We are in a war with a government institution, and they respond better if pressurized by the public. That's my humble request, and a pardon from the public. I'll appeal to the Minister of Health to ensure that they respond as soon as possible. It is already late. We are losing a lot of lives because of this, and let it do it in a good spirit to ensure that at least we have assurance in action that our demands are met. It knows very well, because the same people who work at the Ministry of Health are the same people who work in the hospitals. We stand with them on ward rounds. They have offices there, so somewhere, somehow they pitch us, and they ask you, now what are you going to do if this issue is not solved? They know the issues. They cannot say they don't know the issues. Let them respond to the exact issues, and then embrace dialogue. Let them commit themselves. And lastly, to the interns, we remain vigilant. This is something where we are protected. I can refer them to Article 41 of the Constitution of Uganda. We have all the freedom, we have the law by our side, and let them listen to their leadership. We are their commanders in chief. We know how we are driving this. Let them just act. Their actions are very relevant for our success. Let them not bow down to intimidation until when we have something to say that, okay, at this level we can give the Minister of Health legitimacy. But as long as they still remain illegitimate, we are also choosing to go by our ways. Let them remain and report any form of illegal mistreat in this cause.
That's more of a militaristic, statement at the end of the day. You're really determined at that reason. Yes, Madam Shamim, your parting shot this morning.
Yeah, first of all, we interns are very patriotic, and we really want to serve our people, because despite being in the endemic of Ebola, interns remained on ground, and they are the first lines, or earth workers. They are first attended to by interns, where you find that some even got Ebola, and they were providing a service they couldn't afford for themselves. They couldn't get for themselves. One of the fellow interns got Ebola and was supposed to buy albumin every day. Albumin costs around 300 plus every day, where no government official came in place to help him buy that albumin every day. But thank God he was able to survive. So we are very patriotic. We really want to serve our people, but things have gone out of hand. So I would request the Ministry of Health to respond to us on time, because we don't want to see people dying. If they could respond on time, we are ready to call off the strike if they respond on time. But if they are still playing hide and seek, the strike continues. I would also like to encourage my fellow interns, intern nurses, intern midwives, intern pharmacists, and intern doctors. The strike is still on till we get communication from Ministry of Health, or we get a letter confirming that our money or the disparities in the pay will be solved, and on which date, when should we expect the money. So the strike is still on. Let's be firm, let's be confident. This strike is very legal as we wait from Ministry of Health on what they have to tell us.
All right, thank you so much, Edwin and Shamim, for being there. But then I'll give you a quote for your strike, which is in the book called The Art of War by Sun Tzu. He says, "Tenacity is in the attack, invisibility is in defense." So as you go on with the strike, just have those two at the back of your mind. Yes, well, it has been the Twitter jabs here on Sunrise at Sea. I've been Heston Munenro. I've been having Miss Navida Shamim, Vice President, Uganda Medical Interns United, and also Mr. Chigozi Edwin, Intern Nurses Representative, Uganda Medical Interns United, here to discuss. They were giving us a sneak peek on what is happening in the medical fraternity and why these incessant strikes. But government, really, let's really respond. Let's get our acts together and solve this problem, because it has a trickle-down effect on people that are going into these public hospitals. I happened to move into Mulago Hospital some other time, and really the conditions were a little bit deplorable, and the patient to doctor ratio or nurse ratio is also not improving. And then when complementary measures of the interns are being frustrated in this way, I think then that does not make sense at all. I think government, let's get our act together and respond and stop this strike right away, especially when we are in this amidst this endemic disease of Ebola. Well, from me and the crew this morning, we'd like to wish you the best of your weekend. Bye-bye.